folks. I am back with Colleen Wilkinson, our skincare specialist, who's here to offer some more great knowledge and drop some more knowledge bombs on us. So we're excited to have her here. Thanks again, Colleen, for joining us for this series. A question I get asked often, especially these days, is I am breaking out like a teenager. And this has never happened to me before. I've never had adult acne. And I find that these questions are coming either from people who are wearing masks all day at work or from women who are in their 40s, 50s and hitting menopause. So what can we do about those sorts of things?
So really great question, totally relevant, especially to right now or the last year with the acne. So let me kind of address them in two parts. So
Okay, great.
The first one is sort of I'm breaking out like a teenager, like I'm, sort of in my 40s, approaching 40, whatever. And I've never had this happen. Like, what the hell is going on? Essentially, right? So, because we've all looked in the mirror and been like, what? So, essentially why this is happening, it's very likely hormonal. As we get older and sort of approach menopause as women, and I'm just speaking for women specifically right now, because that's the majority of our patients, our estrogen levels drop. And when our estrogen levels drop, our testosterone levels rise. So what comes with a rise in testosterone is really a rise in sebum or oil production in the skin. So when you have an increase in oil production, you can get a lot of like clogged hair follicles, blackheads, whiteheads, and acne. Okay. So, kind of related to maskne as well, maskne, like wearing a mask all day can also compound that, right? Because you're sort of clogged. Being inside a lot right now, our skin is not naturally exfoliating as much as it usually does with, increased moving around and being outside in all of these different places. So it's a little bit like a double whammy in that increased oil production. And then wearing masks all the time, our skin isn't being exfoliated and our skin cells aren't moving. So when our skin cells don't move, they really get stuck, right? And any extra oil that's being produced gets stuck under there, and then you get acne, right? So what can we do? Well, the first thing is you need to wash your face, right? So you need to wash your face twice a day, which, is hard. A lot of us aren't even wearing makeup now, and we're still having these problems, okay? But when you're wearing a mask all day, you get, bacteria, humidity, all these things trapped under there. Plus, there's no skin cell movement. So you need to use a cleanser, and you need to use a cleanser preferably that has some kind of like antibacterial properties to it. If you are finding yourself a little bit oily, use one with salicylic acid, kind of like an acne wash. Okay. And another thing that we need to do is be exfoliating the skin. Okay. So there's different types of exfoliation. Everybody always thinks scrub when they think exfoliation, right? But there's actually 3 different kinds of exfoliation. So one is manual, which is, your scrub, you're physically scrubbing. Amazing, like continue to do that. But you could also look at adding in like a chemical exfoliant. Okay. So those are alpha hydroxy acids or beta hydroxy acids. And what they do is they just break down the bonds between the dead skin cells on the surface of your skin. And those skin cells sort of slough off naturally, maybe when you sleep or during the day or whatever. The third exfoliation is retinol. So retinol actually turns over, speeds up your cell cycle, which tends to slow down as we age as well, right? So we're just speeding up that cycle and helping our skin cells to move a little bit more quickly. So what I always recommend, can you do all 3 at once? Yes, you can. You do need to sort of train your skin to be able to handle all 3, right? Or you could have some irritation. But just sort of touching base with your practitioner to see if they can recommend any of, adding another type of exfoliant into your regime, and then certainly, some kind of wash. And most people right now do require a moisturizer as well, just for all of the rubbing and irritation.
That's great. Thank you so much. And I know that we're all really dealing with a lot of these kinds of things. So that is really helpful.
Yep.
So if you folks have questions, please let us know and we can set you up with the right products of the kind that Colleen was just talking about. So thanks so much, Colleen. And we have one more thing from you that we will hear next week.
I will see you next week.
Thank you.